When I was a young, scared 19-year-old mom raising a baby daughter on my own, though I had many dark days, and literally some dark because I would come home to find that my electricity had been turned off, once I put my foot on the path of education, I knew that if I worked hard, I could create a better life for myself and my daughter, Amber. It wasn't easy. I worked a full-time job and a part-time job while going to school, but I was privileged compared to so many young women today. I wore inexpensive shoes, but in them, I could put my feet on the rungs of a ladder that made a better tomorrow possible. Quality childcare from a friend, affordable tuition at the community college where I found my entree into higher education, and healthcare and family planning services at a Planned Parenthood clinic near my home. That clinic was the only healthcare that I had for several years, and it made it possible for me to prevent another pregnancy, which would have completely derailed my opportunity to create that better tomorrow. After 2 years in community college and while still working 2 jobs, wearing the only pair of high heels that I owned with the nails protruding through those well-worn heels, I clickety-clacked proudly down a corridor at Texas Christian University on my way to an 8 a.m. English class. I felt the pride of knowing that I was on my way up. 7 years later, remarried, and with my 10-year-old and 4-year-old daughters at my side, I walked across the stage at Harvard Law School to accept my diploma, this time wearing a new pair of pumps. Today, there are millions of American women who are working as hard as they can to create a brighter tomorrow for themselves and their children. But they are trapped in the quicksand of poverty, working 2 or 3 low-wage jobs just to scrape by. And because wages haven't nearly kept up with inflation, the dollars that they earn do not go nearly as far as those that I earned in the 1980s. Affordable, quality childcare is a tremendous challenge. College tuitions, even at community colleges, are out of their reach. And in states like mine, family planning clinics are shuttered as a result of politicians who are using women's health as a political wedge. The equality economy is a vision not yet realized. We recognize that many of our sisters are stuck. Today, they face stagnant wages and unequal pay. Even though women comprise more than 50% of college graduates, they make up 2/3 of all minimum wage workers in the U.S., and 1/3 of them are mothers raising children on just $15,000 a year. Meanwhile, American women are losing the ability to make their own private decisions about whether and when to have children. And without that, women who are living as I once was lose their ability to fight their way up and out of poverty. Reproductive autonomy is absolutely linked to economic opportunity, and lacking the means to manage their fertility means lacking the means to manage their lives. It is just that simple.